Good day to everyone. I am Nicole Angelo Serrano Aranda, and today I'm gonna be assessing to you the abdomen. So the first thing that you should do as a nurse is to prepare all the equipments or materials to be needed at the assessment of the abdomen. So we have here our gloves and alcohol for aseptic technique. We have also here our wet cotton balls to wipe the earpieces of our stethoscope, and of course our centimeter tape, our blanket to provide for client's privacy, pillows, and the client's record. After you finish assembling all the equipments needed in the assessment of the abdomen, you now proceed to the client, introduce who you are, verify client's identity, explain what you are going to do, why is it necessary to lessen the anxiety and fear, and how the client can cooperate. Good day, sir. I'm your student nurse for today. I'm Nurse Nicole Angelo Aranda, and today I'm gonna be assessing your abdomen. In this procedure, I'm gonna be exposing your abdomen, particularly from the chest line down to your pubic area. Is that okay with you?
Yes, ma'am.
Aside from that, sir, I'm gonna be touching your abdomen kasi ipapalpate ko po ito to have an accurate result, okay?
Okay, ma'am.
May I just know what is your name, sir?
My name is Nico John.
Okay. Sir Nico, I have here several interview questions for me to assess your health history, okay?
Okay, ma'am.
So in this interview questions, I am hoping for your full cooperation and for your honesty. Okay? My first question, sir, is do you have any incidents of abdominal pain? Saan po ito? Kailan po ito mostly na nag-occur? At ano po yung characteristic nito?
Wala naman po, ma'am.
Okay. Sir, how about your bowel habits? Paano po, sir, yung pagkain ninyo?
So, once a day po, ma'am.
So, once a day?
Yes, ma'am.
How about incidents of constipation and diarrhea? Or diarrhea po?
Wala po naman, ma'am.
Okay. So, kailan po yung last na nagkaroon po kayo ng constipation or diarrhea?
Last 6 months ago, ma'am.
6 months ago. Anong particular po na sakit yun? Constipation or diarrhea po?
Diarrhea po ako.
Okay, diarrhea. How about, sir, change in appetite?
Wala po naman, ma'am.
Okay.
Normal.
Food intolerances po, sir?
Wala po naman, ma'am.
How about food ingested in the last 24 hours?
In the morning is the rice and egg. The afternoon is the chicken soup. And the evening is the rice and dried fish.
Okay. Let me just repeat what you say, sir, for me to further assess. So, in the morning is egg with rice. I am correct. Am I
Yes.
correct, sir?
Yes, ma'am.
So, in the lunch is chicken soup.
Yes, ma'am.
And in the evening is we have your fried fish with rice.
Yes, ma'am.
Okay. So, do you have any specific signs and symptoms, sir?
Wala naman, ma'am.
Okay. How about previous problems and symptoms?
Wala po naman, ma'am.
Okay. So, these are all my interview questions, sir. So,
Okay, ma'am.
may I just see your name tag again, please, sir? Okay, I just did my proper hand washing a moment ago. All I have to do now is to put on my gloves and to apply some alcohol, okay?
Okay, ma'am.
Okay, in this procedure, sir, I'm gonna be palpating your abdomen. So, in case that you feel any discomfort or pain, you can call my attention, okay?
Okay, ma'am.
Okay, so thank you for your cooperation, sir. So, let me just wear my gloves. And then, next is we should also provide for client's privacy. So we should be closing the curtain, especially in this procedure, because we're going to be assessing the abdomen of our client. So we close the curtains, but here I have here my blanket to provide client's comfort and for privacy. So the next is we proceed to the assessment or for the inspection, auscultation, percussion, and palpation. So the first thing that we should do as a nurse is the inspection. So in the inspection process, by using only our eyes to observe the abdomen of our client. So first is to assist our client to align position, supine position, with his arms relaxed at the sides. Okay? Sir, pwede na po kayong humika.
Okay, ma'am.
So, dito po ang inyong foot part, sir. And ito po ang inyong foot part. Sir, lalagyan ko po kayo ng blanket, okay?
Okay, ma'am.
So, we need to put pillows beneath the knees and into the head to provide clients comfort, and aside from that is to reduce tension from the abdominal muscle. We should also only expose the chest line level to the pubic area of the patient to avoid shivering and chilling. So, because when there is shivering and chilling, it might tense the abdominal muscles. Okay, so pwede na po pa natin i-answer. Expose, okay. Okay, so like what I said, we will gonna doing the inspection first. So in the inspection, we were gonna inspect first the skin integrity. Second is the symmetry and contour while at the lateral position. Okay, so sir, all I'm asking you to do is to take a deep breath and then hold it at least 1 to 2 seconds. Okay?
Okay, ma'am.
Okay. First is the lateral view. Okay. Okay. So here you should observe at the lateral view or while at the side of the client the contour while standing. Okay. Next is you observe the contour at the foot of the bed. Okay. And then if there's any distension, then get your centimeter tape and then put it around the abdomen at the level of the umbilicus. This is to measure the abdominal girth. Next is to observe any abdominal movements associated of respiration, aortic pulsations, and of course, the peristalsis. As well, we observe also in our inspection the vascular pattern. Okay. So that's the inspection process. Now we proceed to the auscultation using our stethoscope. So here is we auscultate the abdomen in each area of the 4 quadrants, and we should take note of the bowel sound, vascular sounds, and of course the peritoneal fissure rub. But first, let me sanitize my earpieces using my wet cotton balls. Okay, sir, so I'm gonna be auscultating your abdomen already.
Okay, ma'am.
So, I will be demonstrating to you 2 patterns on how to auscultate the abdomen. So, starting at the left lower quadrant to the right lower quadrant, up to the right upper quadrant to the left upper quadrant. So this is the iliac region. Okay, that's one pattern. Now let me demonstrate the another pattern that we can use in auscultating the abdomen. Starting also here at the left lower quadrant, but here we auscultate the 9 regions. In auscultating, you don't need to rush. Okay, so that's the auscultation process. So I just take note about the vowel sound, the vascular sound, and the peritoneal friction gap. Now we proceed to the percussion. In the percussion, this is used to detect tympany and dullness. So we percuss the areas of the abdomen on the 4 quadrants systematically. So starting again from the left lower quadrant to the right lower quadrant up to the right upper quadrant to the left upper quadrant. So here, sir, I'm gonna be percussing your abdomen, okay?
Okay, ma'am.
Just tell me if you have any discomfort, okay?
Okay, ma'am.
So this is another pattern of how to percuss the abdomen. Next, in the percussion, you also percuss the liver to know its size. So, sir, papercuss ko lang po ang liver ninyo.
Okay, ma'am.
So, another percussion of the liver, starting here. Okay. So that's the percussion process. So next is the palpation. In the palpation process, we should take note the facial gestures also of our patient when he or she is in pain. So that is another tip. So sir, I'm gonna be proceeding to palpation. So here I'm gonna be palpating, light palpation first, to note tenderness and muscle guarding. Is that okay with you, sir?
Yes, ma'am.
Okay, just call my attention kapag may nararamdaman po kayong any pain or discomfort, parang may stop ko po ang pagpapalpate ko.
Okay, ma'am.
Okay? So first is perform light palpation to note tenderness and muscle guarding. So, make sure na papalpate mo lahat ng 4 quadrants. So, starting here. So here I'm palpating the 9 regions. Wala po kayo na feel na any pain?
Wala po naman, ma'am.
Okay, that's good. About here, mayroon po ba kayong nararamdaman?
Wala po, ma'am.
Next is the palpation of the liver. So, I will demonstrate to you 2 ways on how to palpate the liver. I-palpate the liver to know if there is any tenderness or enlargement. Wala po kayo nararamdaman. Okay. Okay, so that's one pattern. Okay. Or we can also palpate here, starting at the right lower quadrant up to the right upper quadrant. Okay? Wala po kang naramdaman, sir. So, sir, I will proceed to the deep palpation already, okay?
Okay, ma'am.
Since natapos na po natin ang pagpalpate sa liver, okay?
Okay, ma'am.
So, same lang po sa right palpation, pero here is medyo deep na po, ha? So, kung may maramdaman po kang anything, just call my attention. Okay? Medyo madiin na po ito, ha?
Okay, ma'am.
Katulad po kanina, pag-palpate natin sa liver. Wala naman po kayo naramdaman in our deep palpation.
Okay, ma'am.
Okay, next is to palpate the urinary bladder at the top or above the pubic symphysis, especially if the client has history or possible history of urinary retention. Okay, so papalpate ko lang po ang inyong urinary bladder, okay?
Okay, ma'am.
Para hindi ko po makita, I can use my blank. Okay, palpate ko lang po. Wala naman po kayo nakifeel.
Wala, ma'am.
Wala masakit.
Wala po.
So, in palpating the urinary bladder, just palpate here above the pubic symphysis. Okay? So, but you don't need, in palpation, especially in providing clients privacy, since it is just palpation, you can just cover and then palpate. Okay? So, that's the palpation process. I thank you for your cooperation, sir. And then, document all findings in the assessment of the abdomen. So, thank you for watching.